Hi, good morning, everyone. Welcome back to another vlog. This time we have a special vlog where we are going to interview somebody who has been successful recently in the AMC exam and run through the details of how the exam looks like these days. So without any further ado, I would like to welcome Dr. Fatma, who has recently passed the AMC exam. We will go through the journey and ask her some questions. Hello, Dr. Fatma.
Hello, good morning. How are you?
Excellent, excellent. Thanks for joining me. I highly appreciate your time. Congratulations on making it through the journey of the AMC Part 1 exam, which is the MCQ exam.
Thank you. Thank you so much. It's a bit overwhelming talking to you right now because I've seen your videos and yeah. Thank you. Thank you for having me.
No, thank you for giving me your time and giving us your time. I think your story is inspirational. It's motivational for a lot of new doctors who want to get into the system. A bit of a background: Dr. Fatma has been extremely resilient and persistent in giving her attempts and trying to pass the exam. She did it initially 3 times and learned from that, and then worked out to eventually pass the exam a couple of months ago. So it's a great story to share with everyone that motivation, dedication will eventually lead to success. So I'll initially let's start off. Fatma, tell us about yourself.
Yeah, so I'm actually originally from Pakistan, born in Pakistan, brought up in Qatar. And I did my medicine from China back in 2000. I graduated in 2016. And then I worked for some time in Qatar in a hospital. And then I got married and I had to move to Australia to join my partner here. And I think that happened around 2018 Jan. And then, I realized that I have to prepare for AMC, which I was not up for initially because I was preparing for USMLE and also the Qatar exam, so which are pretty different from AMC. So I think I started preparing for AMC initially in April. I joined the course, and and that was the first time I think I started to do that. Yeah.
So you started preparing April 2018.
Yeah.
Run us through your journey from there. What did you do initially? When was the first time you set the exam?
Yeah, actually, I searched a bit about how to prepare for AMC, and it was very vague at that time. And I mean, you don't get much of a support, or you can say tools online how to prepare for AMC. And I had lots of things I could do for USMLE. I was already preparing for USMLE. But I thought that it's better to join a professional training, like a professional course. So I went and I joined a course here in Sydney. It was, I think, a month course. I mean, I met I met a few people who were really good, but the course wasn't much of help, frankly. And they told me that, you need to do this, but a bunch of recalls. So I think I attempted the same year, a few months later, and I failed. I did 3 months of recalls at that time. And I thought that, it's, okay, maybe, the recalls are not enough. A lot of people told me that, and a lot of my friends did pass at that time, the same preparation. And I was like, I don't know, I was in shock the first time when I failed, because I was a good student at, my medical college, and I was a very enthusiastic doctor. I wanted to become a doctor when I was, age 2. So I was like, what's wrong? What did I do wrong? I went back and I prepared again, and I did 2 years of recalls, the second attempt. And I thought that, okay, that's it, I'm prepared. And the second time I failed again. It was the same year, actually. In the same, I think I attempted very quickly. I didn't like wait much. I thought that, the more I wait, the more I lose, forget stuff, and etc. And then I failed again. At that time, it was frustrating, the second attempt. And then the third time, one of my friends, she did emedics and, a lot of, sorry to cut you. Is it okay if I say the names?
Yeah, that's okay. Go ahead. Whatever you feel comfortable.
Sure. So I took, a subscription and, etc. I started preparing for it. And again, the third time, and there are a lot of other notes, do this, do that. And I'm like, okay, I'll do everything, whatever everyone's doing, I'll do. And I failed again. And every 3 times when I failed with a mark or 2 marks. So it was like, like, oh my God, like I can't, like, it's just 1 mark. The first time I failed with 1 mark was really frustrating. And then I decided, I remember, it was a very, very depressing time when I saw your video. And that's why it's a bit overwhelming to talking to you right now. Because I was really depressed. I really didn't know what to do because I also had a miscarriage at the time. So I was really, at a very low time in my life. And I saw your video and I decided that, okay, maybe this makes sense. And, maybe, I'm not preparing the right way. And maybe, I shouldn't depend on recalls. So I think the fourth, and at that time, I actually decided to forget about AMC and start looking for a job because I was really done sitting at home and, just, not doing much. And I started, I contacted a few medical recruiters, and I mean, I was lucky enough to get a job into medical research in a very good company without any, prior training for research or anything. And I think I worked there for 4 months, and I had scheduled my exam, the fourth attempt, in April 2020. And that's when, we had the cancellation because of COVID. 2 months, the exams were 3 months. I think it was canceled, and then I kind of good for me because I was having a baby at that time, and then I delivered in June. So it was a pause for sure. I mean, I also took off from my job, and then I started preparing. I did my John Murtha, the latest edition. I actually went and tried to do my conceptual knowledge and try to make my concepts better, but also like kept things very brief, so to say, for every topic, because I had a habit of going into details, and that's not required for AMC. I'm so sure for that now after failing 3 times. So I think it was this year in April where I attempted. The exam was extremely tough, but thank God I passed. Yeah. So
what were your thoughts after this latest attempt? Yeah, as soon as you finished the exam, what were your gut feeling about it?
I was crying because this time the attempt was extremely difficult, and the questions I couldn't believe. Like, frankly, all 4 times I never got a single recall, not even a single. So this time the exam was really difficult. It was, I mean, I don't know from where the questions were coming. I mean, I knew that they were saying that it's going to be a bit tougher. They've added more stuff, but it was so tough. I called my father and I said that, Baba, I don't know. I'm going to fail again. And he told me that, let's see, it's okay. Just leave it on God. And, but I was expecting another, failure. Yeah, but it was really, really shocking for me that I passed. And I was showing my husband the screen. Is like, can you check yourself if it does say eligible for clinical, because I'm not sure.
See, success after failures tastes a lot better than if you get success straight away.
Yeah, thank God.
In my book, there is nothing called failure. There is nothing like failure. It's just experience. So what you are gaining over over that time, over those 3 years, was experience. And I'm sure that experience will make you a better doctor. And it actually made me a better doctor, more resilient, more investigative, understanding the process better. So I think it's all a part of experience, and I think if the more we look at that way and take out the taboo of failure out, I think it will be good. In Australia, most of the fellowship exams, if you go to them, the passing rates are really low, less than 50%. But people go and attempt it, and it's discussed openly. And then if you learn from your mistakes, that makes you a better doctor, and that's why we're here for. So I've got a few specific questions for you. So from attempt 1 to attempt 4, how did your preparation change, and what were the things that got you across the line?
Um, I think the biggest thing which worked for me, if I look at all the four attempts, is that I didn't, sit and do any recalls, or I did not do any, previous questions or notes from someone, do this, do that, because I kind of feel that's like, it's an easy way. So what I did was I did John Murtha. I did the USMLE case files. It helped me a lot. The USMLE case files is, I think, is really like not rated, underrated for preparation for AMC, because I feel that, the mastery questions are actually from that. The conceptual knowledge is actually from that. And John Murtha is a very good book, but it's very lengthy, and it's very I mean, you don't need that much of it. And also, I did two other books, which I'm a big fan of: Conrad Fisher, Master of the Roads for USMLE, and that helped me a lot as well. So, because I feel that the questions are more, what's the next step? And, what is the most accurate diagnosis? Or, I mean, it's the next step or the most accurate diagnosis. It's like that. So I kind of feel that, for those questions, which were plenty, especially in my fourth attempt, Conrad Fisher was really good. And because the Conrad Fisher, if you know, is a book which is based completely on the next step or the most accurate step or the most confirmatory step for a specific, disease or a diagnosis or, a case presenting. So and also another thing I did, which really helped me, was lecturio.com. It's a website where, they test your knowledge every single day. It's like spaced repetition. So basically, you know where you're lacking. If you're lacking in surgery, if you're lacking in psychiatry or peds, you know where you need to go and, revise or do stuff. So that helped me a lot as well. I would really recommend, everyone to do that.
So just to recap for the other people in the audience who are not aware of these books. So I'm assuming you are referring to Conrad Fisher's Master the Boards.
Master the Boards, yeah.
Yeah. And so we'll put the links down in the description of my video, the previous one that I made on mastery questions, the links of these books down in the description. Going forward, Fatma, so say somebody is starting off AMC first time, what would be your advice for them in terms of a study plan? Say they are going to attempt the exam in 4 to 6 months time.
I would say you need to first, analyze where you're lacking. You need to test yourself. I mean, it's not, it's not useful if you're just heading for an exam and just, doing a bunch of books and saying that, well, let's go. You have to first give trial exams, not just trial exams where, it's just what do you say that, they'll give you the scorecard, not those, but you really need to sit and study for, test yourself where you're lacking. Because the thing is, I feel that, we're coming from different backgrounds. Like even though I'm from Pakistan, but I studied from China. And I practiced in Qatar. Qatar is, we had a very different medical system there from China. So I had like 3 countries involved in my journey. So because of that, things were even more difficult. And, I had guidelines which were relevant to Qatar. I knew guidelines which were relevant to China. And then, because I'm from Pakistan, I knew how things were a little bit in Pakistan. So now that is so much information. You need to like unlearn. I mean, that is the biggest thing I did. I had to unlearn a lot of things, test myself, ask what you are lacking in, and then go forward, then start preparing.
What would be the best way to test oneself for somebody who's starting off new?
I wish there was exactly some accurate, website or way we could test for AMC specifically. But as much as I know of, there are a lot of websites, there are a lot of formal exams, which are like, they give you a scorecard, they give you a very tiny feedback, but you still don't know that if you are a 20% or say a 60% peds, but a 30% in obstetric and gynecology, right? So the only website I know for sure, which I did, is lecturio.com, because exactly a month when I had a month for my exam date, I analyzed myself, or I analyzed my brain through that website. And it was saying that, well, you know what, you're an 80% in ethics, but you are a 30 or a 40% in internal medicine. So what I did, I switched everything. I started doing internal medicine, which was a big, you can say, my weakness. And I worked really hard on internal medicine. So that eventually, 2 months later, or a few months later, and I postponed my exam date.
Sure, seems like you're having a bit of a technical glitch, but I'll continue on that. So the things that you can use to test yourself on is something like a subscription of BMJ on exam. That's a pretty good website. It's actually based on the PLAB format, but sometimes what happens is that that sort of a thing will help you understand the process a bit better, especially if you're trying to test yourself. There are a few other websites which I possibly can recommend. What I will do is I'll put the link down in the description and we work it out from there. So just recapping what Dr. Fatima has said is that number one, the most important thing for us would be going through initially assessing yourself. So some of the websites we have recommended, we've just got it back now. So that's fine. So all I was doing is repeating what you've said. So initially, when you're starting off the exam preparation, just make sure that you have tested out yourself a little bit. There are a few online resources which we have recommended. And then once you have tested out yourself, then what would be the next approach, Fatma? Sorry, we are unable to hear you. You are mute. So could you repeat that again with unmuting yourself?
Yeah, can you hear me now?
Yeah.
Yeah, I think once you are aware of, where you're lacking in, for example, if it's, internal medicine or whatever, that's when, you make a plan where what you're supposed to do as an off, like, there's resources, where you need to study, how you need to study. And also for AMC, I feel that, it's not much of like detailed knowledge. It's a very, you can say it's a very brief knowledge. For example, if you're studying for rheumatoid arthritis, you don't need to like go for a detail and, of the entire disease or, the latest guidelines in sense of not the guidelines, but latest research involving drugs and etc. You need to have a very brief knowledge. It should be very like, okay, what's, the symptoms, what's the diagnosis, how do I approach the patient, what's the medication. So yeah, I think that's that. And also I feel that, for AMC, I feel that the books which are pretty famous is the Blue Book and also John Murtha. John Murtha is a very good book if you really need to, revise your concepts. Or I think it's very good for people who are into general practice, and it's a very quick, not a quick, but a very easy to understand book if you're coming from different systems, and to understand Australian system. But the other books, Blue Book or I would never recommend those. I mean, it didn't work for me. I mean, that's the thing.
Which books are you recommending?
The Blue Book, I wouldn't recommend. I would recommend, either studying from John Murtha, only if you are lacking in conceptual knowledge or you really want to understand the Australian systems in terms of ethics and also a lot of, internal medicine questions. But other than that, I would recommend, Master of the Boards, Conrad Fisher, and I would, definitely do some USMLE questions, Kaplan questions. Because when I did Lecturio is pretty much, the USMLE questions, USMLE Step 2 CK questions. Those are really relevant in sense of learning a topic or a conceptual knowledge or, revising stuff.
Yeah, that makes sense. And just to clarify, so when you say doing John Murtha, you're not saying doing cover to cover. You're mainly saying if you've read a topic, you want to read a topic, you go to that specific topic and then read that through. Would that be right?
Yeah. Yeah, in AMC, on AMC's website, there is a list of topics which they really want. They're saying that we'll be testing you on these specific topics. So what you can do is you can take the list of those topics and you can study those list of those topics from John Murtha. So, that's that. You don't need to go from the entire 80 chapters or anything. It's just maybe, I think, a few chapters.
Yeah, perfect. I would actually like to share one resource that really helped me out. So as you were mentioning that having snippets of information, relevant information, what's the next step, what's the next step. This app is something I use quite often in my practice. It's called BMJ Best Practice.
Oh, yeah.
If you can get your hands onto that app. So say, for example, we were looking at sickle cell anemia, for example, or polycystic ovarian syndrome. So what you do is you just Google it and it'll tell you management, diagnosis. So for example, if I wanted to find out what's the first step in diagnosis, then it tells you, it gives you an approach and it tells you about the investigations. And you can basically go through them step by step very, very quickly rather than going through books and stuff. So that's one other tip. Brilliant. Look, I think you've summed it up quite well, that going through targeted resources, but then elaborating on them if needed, if you feel that the knowledge is lacking, in going through John Murtagh on that. For psychiatry, that's one area that a lot of people struggle on, and that's an important part of the exam. What were your tips on that?
Psychiatry was a struggle for me initially, and they have lots of questions which are very pharmacological based, and it's so difficult to even come around those questions because some don't, it doesn't make sense to someone who is studying USMLE because it's very different. Their approach to question is very different. They don't expect for you to. Some of the questions I would just wanted to add this to our conversation, that some of the questions are not expecting you as a physician to analyze. Usually in USMLE, that's what they want. They want you as a physician to analyze the question, the information given to you, and then come up with the best, most likely diagnosis or whatever you think is correct. But for AMC, they're pretty much expecting what you're going to answer, right? So they're not expecting you to analyze the question. They're giving you flashcards, like buzzwords, and they want you to pick the answer. So if you try to think a lot on those questions, you're going to answer the wrong one, because that happened with me. I used to really go, maybe this is that, maybe this is that, and that's not what they want. So it's very precise, very to the point, and that happened. That was the thing for psychiatry for me. So what I did for psychiatry was, there was another resource I would ask you to link that here is, I did a course from this person on Facebook, Paul Edroyd. He had, so what he does is basically he gives the latest information from UpToDate, from RSCGP, or psychiatric latest guidelines from Australia, and he'd tell you, for example, that if you are you want to know what is the most latest guidelines for bipolar, he has the information in chunks. This is what you need to study, and you can just revise those questions. But I think the fourth time I had very less psychiatry questions. I don't know if that was the reason why I passed, but I think I was prepared this time. I gave too much time to drugs. And I really sat and studied the classes of drugs for pharmacology, specifically for psychiatry, because I think that's relevant and really important, because they really want you to know the side effects and et cetera, et cetera. But it's very brief knowledge. It's very precise. They don't want much of detail. They don't want you to study the detail. So that's that. And because the thing is, as an of resource, John Murtagh doesn't have anything for psychiatry, like not much.
Nah, it doesn't.
Right.
It doesn't.
So what I did, I stuck to the USMLE part. I took a lot of help from MTB, studied the disorders. It's very precise. It's very basic. Like study the defense mechanisms, study the latest eating disorders. That's it. That's what they want. And then, for example, if you're studying anorexia, they want you to know, okay, your brief knowledge on anorexia. That's how I did. For example, I studied for anorexia, and then I went to UpToDate or to the latest guidelines to know, okay, is there any information added to it? So for me, this part, to make it easy, was done by Paul, the guy who helped me. He has his course designed. Um, yeah, so that helped me. It was quick.
Perfect. Perfect. And now, talking about courses, do you recommend people going into courses? And if so, what were the different options? If not, then is it just better to stick by the plan you have given, and that's the best way to go about it?
See, I think it's completely your personal personal choice. For me, I did a face-to-face course from one institute here in Sydney, and they gave me like they gave me like this big printed copy of John Murtha, like and they're like, okay, study. I'm like and then I did like other formal exams, or I would really suggest that, I know a few friends who have taken the face-to-face course from this institute, from 3 institutes. Can you believe the all the popular institutes of Sydney? They've taken the exam and still struggling to pass. Now, I feel that the thing is that it's not a specific institute or a specific lecture notes of a guy from a person, or which will make you pass. It's your own conceptual knowledge. It's your own preparation. So you should analyze where you're lacking. If you do need a course, just go for it. But if you don't need a course, just study from the specific material and pass. And that's how I think a lot of people do pass without that much of struggle, which I went through, or taking lots of courses. They do a few books and they're done. They're good to go. So
now
yeah.
you mentioned a very interesting comment in the last time when I spoke to you, was that your husband also watched my videos, and he's not a doctor.
Yeah.
But he analyzed something. Can you shed light upon that?
Okay, I'm really bad in maths. I'm terrible in maths. Like, that's one of the reasons why I'm a doctor. So, I really like the way in your video you were like, so this much percentage of questions will come, adaptive questions are adaptive, and then the mastery questions. So, there is a weightage of such questions. And I was like, it's a bunch of lots of maths for me too. There was a lot of maths in your video. So I think he really helped me, he watched your video, I think, a few times and told me that, what, because I failed so many times, he's half doctor. He knows exactly which books to study from. So, we have this joke. He said that we've been married for 4 years. He said that, 6 months you are preparing for exam, and the rest of the 6 months you're crying that you failed. So I think that he helped me prepare in terms of the maths, that, well, you're 20% lacking in this, your 15% knowledge is not working for psychiatry, go study more obstetric gynecology. So yeah.
No, brilliant. Look for people who don't quite know what's a mastery question, and they may not have watched the video. Could you just recap on that?
Okay, the mastery questions is, lots of questions which do come in your 150 MCQ questions, where you'll be either scored more if you correct them, or probably, I think they're, as of my understanding, they're more into acute care, they're more like
Correct.
ER scenarios. And that's where you'd recommended the USMLE case files. And that was an amazing book for me. And let me tell you, what was the time, because I have a baby. I was preparing with my son, Ayan. He was 8th month at that time, and I was really struggling to study, and my husband had a job, and etc. There are 50 case files in that book. I read the last case 50 10 minutes before my exam slot. I mean, I was so like, busy, you can say that, I had no time. But I think that really helped me. The mastery questions are really important. You can be really well prepared for other things, but if you're lacking in mastery questions and acute care or urgent ER scenarios, they're not always into pediatrics. They're also in obstetric and gynecology. They have like mix of cases. You can fail. I mean, you will fail. So you need to prepare for them. So
Perfect.
yeah,
Perfect. Yeah. That is something I have experienced firsthand. So I've, like you, failed with 1 mark or 2 marks, and the reason was because of mastery questions. I'll definitely link the video down in the description if you are into details of things. Before I sign off, Fatima, thank you very much for giving us your time. Highly appreciate that. I think everybody's going to benefit from it.
Thank you so much for having me. It's such a overwhelming experience talking to you again. Thank you.